So someone asked in the comments, they had palpitations, the testing was normal, what should they do next? So there are a few things to check. One, it's important that you were actually having the symptoms of palpitation or whatever symptoms you're having while you were wearing the event monitor. And that's the test that's normally done for palpitations is a monitor, which is a 24-hour ECG monitor. And it's important that you were wearing the monitor when you had symptoms, because sometimes, unfortunately, people have symptoms at a different time. And then when they're wearing the monitor, they don't have symptoms, and then they have symptoms again. So the test is not that helpful if you didn't actually have symptoms while you were wearing the monitor. The second thing is to make sure to look at the actual report. So there are a lot of normal findings that can actually cause symptoms, but are normal in that they are not dangerous to you. So that could be like sinus tachycardia, sinus arrhythmia, PVCs, PACs, all these things can be normal, but you may actually get symptoms from it. And so then it's important to look at the report, because in a lot of those cases, medications like beta blockers can help, but also other things can help as well. And so it's important to actually see the report. Sometimes you just hear back, from someone at the office that the test results were normal, but it's important that you actually look at the report and see what the report said, as far as what did it actually show, what did the monitor show while you were wearing it. Now, the other things related to the heart that can less commonly but could also cause palpitations is sometimes if you have heart valve issues, that can sometimes cause that. And so an echocardiogram, which is an ultrasound test of the heart, would look at the heart valves. And also sometimes, occasionally, if you have risk factors, if you have blockage in the arteries, sometimes that can cause different symptoms in the chest. So if you have blockages in the heart arteries, and so a stress test can be done, and there are other testing too that can look at if you have blockages in the artery. But those are the other tests for the heart that potentially, could find something if you're still having symptoms and your event monitor 24-hour ECG test was normal. And then if none of those things show, the answer, then it's possible it may not be related to your heart. And so the other things in the same area as the heart are your lungs, there's muscle tissue, and also your esophagus is in that area too. And sometimes those things can cause symptoms in your chest as well. And so those are other things to consider.